Peace, love, and Parkinson's is our topic this afternoon on the Jenny Springer Show. Yes, Dr. Flynn and her patient Erik, who will be explaining to us what life is like to have Parkinson's disease. But first, Dr. Flynn, let me ask you a couple questions. What exactly is Parkinson's?
Well, Parkinson's is a neurological disease that affects the substantia nigra region of the brain, as seen in this picture. And the disease affects neurons that produce dopamine, which usually will be sent to the part of the brain that controls movement, but this disease kills them off. So instead of him having control of his movement, he gets pretty twitchy.
You have problems? Oh,
Yeah.
Okay.
As you can see.
Thank you, Dr. Flynn. I'm already depressed. But Erik, what are some symptoms you have experienced so far?
Well, at first my family began to notice that I had a lack of facial expressions.
Clearly.
I didn't need your input. But anyways, so, I don't know. I didn't really walk around as much as I used to. I didn't really see it as a problem, but I guess my family did. Then over time, my speech began to slur a little bit, and like my hands kind of shook uncontrollably if I held them like this, and like I started getting muscle tremors, and oh man, it's just I started having anxiety. I couldn't do normal functions like brush my teeth, shave, write my name. It's just a depressing time.
Okay, we do need time for commercial breaks. I'm sorry for your loss. But, Dr. Flynn, how does he get this disease?
It was most likely hereditary, got it from his parents, grandparents,
Yeah.
but it probably developed later on in his sad life.
It's interesting.
Yeah, or he could have developed it from like a viral infection or like exposure to like environmental toxins. Like,
Right.
have you been eating pesticides or something?
Okay, awkward. Okay, well, what about, besides what you and your family had noticed, how did the doctor actually diagnose this disease?
Well, the first thing they tried to do was test to see if I held out my arm, if it would shake uncontrollably.
Probably.
Yeah, that didn't go over so well. So they also checked if I seemed to have a stiffness in my limbs and neck. They also tested to see if I could raise my hands up in the air without them shaking. And then they also saw how quickly I was able to regain balance. Yeah, that didn't really work either. They also tested if I could walk normally too, but yeah, it just ended up with me flat on my face.
And this is the moment that I realized Erik had Parkinson's.
That is beautiful. Wow, is there any cure for this miserable man, honestly?
Well, no, actually. Medications can help him, like, to suppress the symptoms, but it can't actually reverse the disease. According to my notes, patients can take chloroxidopa, MAOB inhibitors, dopamine agonists, and anticholinergics to suppress their symptoms. Or in extreme cases, we use a brain stimulator, in which case this little machine that's battery operated gets put into the chest, wire run up to the brain, and the brain helps control with the false signals so he can be not so twitchy in his everyday life.
It's not working. Oh, okay, that's kind of disgusting.
Whoa. What did you put in my brain?
We inserted a
Well, what?
brain.
No. Listen here. 1 in every 200 people are diagnosed with the disease, and you decide to put a pulsing thing in my head?
Yeah.
What about all those people that eat flying foxes in Guam?
What are you talking about?
I don't know, but people in Guam eat flying foxes, and these bats eat seeds that have a neurotoxin that makes them more likely to have this disease. So why don't you do that to them, huh?
Well, okay, he's obviously getting a little crazy, probably just the Parkinson's talking, so back to you.
Yeah, well, you know what? Ever since you doctors discovered this disease, or actually James Parkinson's in 1817, you know what? You guys don't even know what you're doing. You don't know how to handle this
know
disease.
exactly what we're
Dude,
doing.
I'll show you what crazy is like.
You will?
You know what? I'm
Show
gonna.
me.
I can't help it.
Please, calm down.
What do I
It's
do?
okay. Calm down. Calm down.
Okay,
well, I think you know what Parkinson's is.
Calm
So now that you know the